Hi, my name is Tulane. I'm a student at Nova Southeastern University. This is my patient Janice. Do I have your permission to record this for educational purposes?
Yes.
Okay, so today we're going to be doing the goniometer flight plan. We're going to start with our testing that can be done in seated. The first thing we want to test is hip internal rotation. So to do that, I'm going to have my patient bring her foot out to the side. Okay, and since I see she's able to do that, I'm going to determine the infield by applying overpressure. And the infield is firm. So since she's able to do that, I'm going to go ahead and align the goniometer. The axis is going to go over the center of the patella. The stationary arm is going to be perpendicular to the floor. And the moving arm is going to be midline of the tibia and between the two malleoli. Go ahead and perform that motion one more time for me. So realigning the goniometer. I have 30 degrees of hip internal rotation. The AAOS norm is 45 degrees. So using the same landmarks in the same position, we're going to test hip external rotation. So I'm going to have my patient bring her foot in, please. Okay, and try not to lift your knee off the table in doing so. Since she's able to do that, I'm going to determine the infield by applying overpressure. And the infield is firm. So the same landmarks, the center of the patella for the axis, the stationary arm is going to be perpendicular to the floor, and the moving arm is going to be midline of the tibia between the two malleoli. Go ahead and perform that motion one more time for me. And based on my measurements, I have 22 degrees of hip external rotation. The AAOS norm is 45 degrees. From here, we're going to switch to the foot and do plantar flexion and dorsiflexion. So we're going to start with plantar flexion first. I'm going to have my patient push her toes to the floor. Okay, since I see she's able to do that, I'm going to determine the infield, and the infield is firm. So to align the goniometer, I want to make sure my patient's foot is at 90 degrees. The axis is going to go over the lateral posterior aspect of the malleolus, the stationary arm in line with the fibular head, and the moving arm parallel to the base of the fifth metatarsal. And go ahead and point your toes to the ground again for me. And based on my measurements, I have 54 degrees of ankle plantar flexion. The AAOS norm is 50 degrees. So next we can measure dorsiflexion. So I'm going to have you bring your toes up to the sky for me. Okay, since I see she's able to do that, I'm going to determine the infield by applying overpressure. And the infield is firm. Go ahead and relax. So to start, we're going to use the same landmarks. I'm going to make sure my patient's foot is in 90 degrees. We're going to align the stationary arm with the fibular head. The axis is going to be over the lateral posterior aspect of the malleolus, and the moving arm is in line with the base of the fifth metatarsal. So go ahead and bring your toes up as far as you can. So based on my measurements, I have 5 degrees of ankle dorsiflexion, and the AAOS norm is 20 degrees. So next we'll switch to the testing positions that are in supine. So I'm going to have you lay on your back for me, please. And we'll readjust. Okay, so the first thing I'm going to measure is knee flexion. So I want you to go ahead and bring your foot back as far as you can. Bend your knee. Okay, and since she's able to do that, I'm going to determine the infield by stabilizing and applying overpressure. And the infield for knee flexion is soft. So to align the goniometer, I'm going to look for the lateral epicondyle and align the axis. The stationary arm is going to be in line with the greater trochanter. And the moving arm is going to be in line with the lateral malleolus. And is your foot back as far as it can go?
Yes.
Okay. And Based on my measurements, I have 127 degrees of knee flexion. The AOS norm is 135 degrees. So next we'll transition to knee extension. So go ahead and extend your knee. The first thing we want to do is prop the ankle up on towel rolls so she can get her full extension. Okay, relax this leg. And we'll do one more. Yeah, this leg. Okay, so I'm going to determine the infield by applying overpressure. The infield is firm. So to measure, I'm going to align the goniometer in the same landmarks that we have for flexion. I'm going to find the lateral epicondyle. I'm going to align the stationary arm with the greater trochanter and the moving arm with the lateral malleolus. And based on my measurements, I have 4 degrees of knee extension, and the AOS norm is 10 degrees. So we'll remove these. The next thing we want to test is hip flexion. So I want you to bend your knee for me, and I want you to bring your knee back to your chest. Okay, since I see she's able to do that motion, I'm going to determine the infield. I want to feel for the AIS and place my finger there so I can feel for anterior or posterior tipping. And in this position is her infield, is her end range, and the infield is soft. So can you hold this position for me? I'm going to align the goniometer. The axis is going to go over the greater trochanter. Can you move your arm here for me? The stationary arm is going to be midline of the pelvis or midline of the mid-axillary thorax. And the moving arm is going to be aligned with the lateral epicondyle. And based on my measurements, I have 92 degrees of hip flexion, and the AOS norm is 120. So the last test that we want to do is hip extension. So let me have you lay on your stomach, please. Okay, so using the same landmarks as hip flexion, we're going to test hip extension. So I'm going to first see if she's able to do it. Can you lift your foot and your knee up off the table? Okay, keep your legs straight. Okay, good. Since she's able to do it, I'm going to go ahead and determine the infield. And the infield is firm. So using the same landmarks, I'm going to align the goniometer at the greater trochanter for the axis, the stationary arm, the midline of the pelvis or the midline of the mid-axillary thorax, and the moving arm is going to be in line with the lateral epicondyle. So go ahead and perform that motion for me again. Okay, and based on my measurements, I have 6 degrees of hip extension, and the AOS norm is 20 degrees. Thank you.